As your station for Health, October is the time to raise awareness about breast cancer, a condition that will affect 1 in 8 women over the course of their lifetime. Dr. Putao Cen is a medical oncologist with UT Health and the Memorial Hermann Texas Medical Center. She's also with UT Physicians, and we're glad to have you here this morning. Good morning to you.
Good morning, Sally.
Well, I want to talk first about how common breast cancer is in the United States. Why is it so common here?
Yeah, so being a woman, you expose yourself at risk for breast cancer. So 1 in 8 women will be developed breast cancer in their lifetime. About 266,000 new cases of breast cancer will be diagnosed in 2018 just in the United States.
And what groups are most susceptible to developing breast cancer?
Female older than age 40, and also obesity, lack of exercise, smoking, alcohol, or late menopause, or less childbirth. Those are all risk factors for female developed breast cancer.
Let's talk about some of the warning signs and some things that should really make you say, oh, I maybe should go see my doctor because of this. What are some of the warning signs you can tell people?
The most common finding detect it's a lump or a mass on the breast. It's the most common symptoms. And other symptoms could be a swelling of the breast, or redness of the skin, or retraction of the nipple discharge, or dimple of the skin, or finding a mass on the armpit, like axillary area.
And I think it's so important for women to realize that they're in control of their health and that they have to go and get their yearly mammograms and so forth. What are the recommendations right now for when women should go get their mammograms?
Yes, mammograms save life because they detect breast cancer early and offer early treatment can get cured. So I would recommend women to consider to have a mammogram start at age 40 because even though age 40 to 50, they have a less incidence of breast cancer compared to age older than 50, but just think about the potential, the number of the years of life saving when you started early.
Sure, and if you have a family history of breast cancer like I do, I know my doctor recommended my mammogram start much earlier than 40 because of a family history, so there's that as well. What can women do at home to check for breast cancer?
We can recommend a self-breast exam start at age 20 because women do sometimes get their breast cancer at age 20 to 30. And then once you reach age 40 to get a mammogram.
Have treatment options really improved over the years?
Yes, so there's a significant decrease in breast cancer mortality in the United States. One is because of a screening mammogram, and the second is because very important is because of treatment advanced. So for example, the HER2 positive breast cancer, and we have a HER2 direct therapy. When you have an early stage breast cancer, the cure rate could be 90%, and also for hormonal positive breast cancer, and also taking the anti-estrogen treatment for 5 years to 10 years could also have increased a lot of cure rate.
Well, we're so glad that the entire month of October is dedicated to Breast Cancer Awareness Month, which is such an important topic for women and men to know about as well. So we appreciate you coming in and letting us know all of the latest.
Thank you.
Thank you, Doctor. Lena.
Yes, ma'am. It is time to give a big